This is Justin Case of American Newscape, joining my friend and mentor, Dr. David Dixon. He's here sharing insights into wound care at home. Greetings, Dr. Dixon. Welcome to American Newscape.
Hi, Justin. It's a pleasure to be here. Thank you for having me.
Well, it, it, we're excited to have you here. The holiday seasons are upon us. It's time for me to reflect on certain blessings, on the what's and who I'm thankful for. That's why Dr. Dixon is here. I'm reminded every morning of his remarkable works. When I put my shoes and socks on, that reminder is I still have feet. Dr. Dixon, let's kick this off. Please share some of your background with us.
Well, I'm a physician. I'm an MD. I did my undergraduate work at Fisk University in Nashville, Tennessee, and I did a post baccalaureate program at Creighton University in Omaha, Nebraska. And I went to medical school at the Medical College of Ohio in Toledo. And I have extensive background work in tissue regeneration techniques. I was a tissue coordinator for the Arizona Lions Eye Bank, and I also worked for the Lucas County Coroner's Office in Ohio.
Wow. You know, I was going through some of my issues, attending wound clinics, and having a lot of trouble getting things healed up. My wife found Dr. Dixon's website. It's DermaWound. She kept telling me to go there to look at this. She was studying his videos, reading his works, and I had gotten in such a mental state. I was tired of dealing with any of it. I was trapped in the wound clinics, spending a tremendous amount of money. But I went there, and I think uh, I bought some product from you just so I wouldn't have to hear about it anymore. And I was indeed willing to try it because I had almost started to believe that it was hopeless. And the product came in, and I started using it. It was easy to use. I'd had so many problems dealing with wounds in my past that I was a very clean wound. I had dressing skills, as good as most nurses. And here came this product, this simple product that I would put on at night, and my goodness, I started seeing some results, and at that point I was thrilled. So I wish you would just talk about DermaWound. It's a product I'm extremely grateful for, and if you just share a little bit more about it, I think we would all learn something.
Well, DermaWound is a really wonderful product, and I'm really grateful and thankful for your wife to really push the situation so you would get out of the normal everyday wound care clinic going in for debriding,
Mm.
which leads to more debriding, which is very painful. My product is a very simple, easy to use product. It's pretty hard to make, but it's kind of a multi use product that can be used in many different applications, such as like you had just a chronic non healing wound. You were an otherwise healthy individual. You could have had a little bit of infection in there, seated in there, and that could have really prevented you from healing quickly without any outside help. But you did, from hearing your story, you did get in a little bit of trouble. And luckily, we were there to help out with a simple, easy to use, I think fairly inexpensive product for what it does. On the other end, I think you told me earlier that you literally spent thousands and thousands of dollars uh, trying to get your wound to heal with uh, you weren't able to do that on your own. And then going to the wound care clinics, God bless them for being there, but we think we have a better, safer, easier, quicker way to do things.
Well, it certainly worked for me. I was going to the wound clinic 3 times a week, and once a
Mm-hmm.
week, and this was, this may be biased on my part. I thought I was making progress, and then that deep deep reading would go on, and my goodness, not only the pain, but it seems like it would set the wound back. and it just seemed like a nonstop cycle. And I also remember that they kept pushing me. You need to be in the hyperbaric chambers, for so many dollars, three treatments a week. And in 6 months, we will have this problem resolved for you. And I just wasn't getting the results. And I'd gotten in a point where I'd lost hope. And I think it was probably about the third or fourth application of the material, I started seeing some benefit. And then I actually called your office and got some support. And because I hadn't bothered to read everything that you provided me, they suggested that I not apply this during the day and apply it when I went to bed, and then, clean the wound at night. And that's what turned the trick, So now I saw the light at the end of the tunnel. So now I was re-energized. Now I was doing what I had to do. Now I was watching my diet. Now I was watching my exercise. So, for those people out there that have, I don't want to say you've lost hope or you're at least concerned or you're feeling the anxiety of this worked for me. And, I'm not recommending medical procedures to anybody, but this really worked for me. I encourage you to investigate it, and just, let's get back to Dr. Dixon, because that's why we're here. Dr. Dixon, how did you come to develop this product, and when did you develop this product?
I'll answer that here, but I did want to say that your story is very, very typical. People go into the system, they're looking for help, and it is a revolving door, unfortunately. And the types of products that they use really don't solve the problem. It just kind of keeps you hanging on. And it's very unfortunate that the system is set up that way. There are success stories, but more often than not, you hear pretty typical stories like yourself. Getting back to your question of how I developed this, it started when I was in medical school. I watched a story in an ethics class on a gentleman who was burned in an oil field fire in Texas. And he subsequently recovered 100%, but he was burned very, very badly, over like 80% of his body, and he was just not supposed to survive. And he kind of looked like Freddy on Elm Street, on Nightmare on Elm Street. Facial deformities, everything else, where he had to wear the mask to keep his face up against, keep his face from falling off. And he got through that, subsequently married a beauty queen pageant, I believe, from Texas, and had a wonderful family. But they asked him, they said, Mr. X, if you had to do it all over again, would you? And he said, no, I wish that you would have given me a gun and let me shoot myself in the head and basically get this pain and suffering over with. It was just too much. So in this video about his life and his recovery, it showed him going through various stages of wound care. And there was debriding, there were the whirlpool baths, there were the hyperbaric oxygen chambers, there was the skin grafting. And I just said to myself, there's got to be a better way. And so I prayed on it, and I went to various different texts, old ancient text, biblical text, and I did my research. And I said, what did they do in the old days? And so that really was kind of the basis for my formula. And after about 3 years of refining the product, where we could cut down on allergic reactions, skin sensitivities, different types of allergies, like to honey. One of the first things I worked with was honey before there was Manuka honey. And it started opening alternative paths of treatment that I was not exposed to in medical school within regular allopathic education. So I'm an MD now, but I'm really more of a naturopathic type of person. I believe in homeopathy. I believe in naturopathy. I believe in chiropractic. And I just think that there's so many wonderful things out there that get kind of glossed over in regular allopathic medicine. And that's why I'm glad to see laws passed like the right to try and different things like that to give people options, because there are wonderful options out there that I wasn't even, exposed to or trained in a regular allopathic setting. Now, somebody has a broken leg or they need a heart transplant, brain surgery, allopathic medicine is the best. When you need an antibiotic, it's the best. But oftentimes, it really unfortunately has become kind of a more money oriented type of business, and it really shouldn't be. So I tell people, who have wound care centers and stuff like that, and they've got the hyperbaric oxygen chambers that I think are wonderful if you've got a brain injury, if you get the bends coming up from the ocean depths. So hyperbaric oxygen chambers are fantastic. I just don't think that they really are that beneficial for wound care. I mean, if you take a blood pulse oximeter reading, your O2 sat is going to be at 98, 99% anyway. So I just never really saw the benefit in kicking it up one more percentage point. And if you get in one of those things, if there's a problem, they can't just shut it off and you get out. You have to be very, very careful. People have had heart attacks in them. People have eye problems. So I just said, let's just try and keep it simple. And that's what we've done. It was very, very difficult in the beginning. People didn't want to hear anything I had to say, but the results and the benefits and the patient testimonies from people like you, Justin, were just really the driving force to put us out in the forefront. And I think DermaWound is the best wound care product in the world, and nothing can touch it.
Well, yeah, I believe that too. And, my beliefs are based on results. You talk about Manuka honey, and I know that's that miracle expensive honey. Does it have additional medicinal properties that regular clover honey doesn't have? Or
That's a good question. Basically, when I first started looking at Manuka honey or the type of honey, really it was just any kind of honey. But in order for you to get FDA clearance, you've got to utilize the same exact bee. It's got to be right in the same area where they are foraging and gathering their nectar. It's got to be measurable. You've got to have everything in a very rigid type of system. But from what I've seen, honey's honey. Um, you've got different types of flavors, different colors. It's a natural product. It's going to change. But I think honey's honey, and that's one of the reasons why I didn't really focus on it too much, is honey's honey. People were having allergy sensitivities to it. And so I just thought, we can even make this better. And that's what I did with DermaWound.
well, I think you did. And you talk about. I think as a person out in the community, we saw for a long time that these pain management clinics were popping up, and when the pain management clinics were losing the shine was off of their diamond reputations, then these wound care clinics started popping up, and I think a lot of the, you talk about the bends, and I could see going into a hyperbaric chamber and being faced with the bill. That's enough to give anybody the bends.
It's yeah, and then you'll go in and you'll get a script for 20 visits. That's how come we have problems with the healthcare system that we have now. It's really kind of overpriced. Um, And to me, there's just a lot of extra work that goes into wound care that doesn't need to be there. The first thing I tell people when I'm giving an in services is you've got to leave the wound alone. The less you do to the wound, the better. You don't want to keep making it bigger by debriding and putting people through the pain and the suffering that goes along with these deep breathing sessions. They're just horrible. And the people that do it, they really, I think deep down inside, they think that they're doing something good because that's what they've been taught. But a lot of people just don't have that creative, innate creativity to be able to step out of the box of what you've been taught. And so they just debride. They'll use Santal, which is a debriding agent. I think it's very painful. It's very expensive. Every time they go in and they pull out the scissors and they start to debride, it's a $150, $200 charge. And people don't see that charge. That's how come I'm really glad to see transparency and billing come to the forefront, because somebody has to pay. And the premiums that people have to pay for insurance is just, it doesn't make sense. It's nonsensical. And I tell people, if you really are trying to help people, you don't need to do all these things. And if you really want to make a lot of money, you should go into something else. Healthcare should not be an industry that one goes into to make money. My father, who was a dentist for 50 years, would tell me, David, it doesn't matter, don't just do a good job and people will come. You don't need to charge an arm and a leg. Not that I ever did, but that's what I learned growing up and watching him and watching how he did things and how he cared for people. And it was never a money thing for him, but he was very successful. And as a result, I had a great childhood growing up and was able to go to a private college. I paid for my medical school, however, though, but they were able to give that to me. So I was very grateful for that. And it really stuck with me to always do the best job. Don't be worried about money. The money will come, and it has. I'm very comfortable now, and I get very wonderful phone calls out of the blue from people like you thanking me for 5 years ago or 10 years ago, or from helping someone that they loved, or themselves, like yourself, where every morning you wake up and you look at your feet and you say, thank God for Dr. Dixon. And that's what really keeps me going and really means so much to me. And I'm very blessed to be able to be in a position to help people like yourself who didn't see any help and had no light at the end of the tunnel from this procedural, wound care type of merry-go-round that people get on when chronic non-healing wounds are involved.
We sounds like we should show some gratitude for your father too. I mean, proves that the apple doesn't fall too far from the tree, and he sounds like he brought you up with that face in the mirror, which a lot of us need. You need to look at yourself in the mirror in the morning and make sure that you like who you see. And
yeah, absolutely, absolutely. And one of the things that you probably see some pictures behind me. These are from right up. Let me see over here. My mother worked for Senator Barry Goldwater. She was the first African American hired by a Republican after Reconstruction. And Senator Goldwater and the people around me, my grandparents, really had a strong influence on where I'm at today. And I am grateful, and I'm very lucky that I did not fall into that pattern of just trying to make a buck. And it was very tough for a while. I was on my own for many, many, many years, fighting the good fight. And now things seem to be going along pretty well. And I get great phone calls from people like you. I'm semi-retired now, just turned 60. And try to eat well, try to take care of myself. And I'm very blessed and happy that I can help people like you who really need help when there just looks like there's no help available, and it's going to be a long, painful road to recovery. And it doesn't have to be when you have a product like DermaWound.
Well, and let me jump on my soapbox. During, I had to race to order another tube of DermaWound, and got it. And of course, they express it out because time is of the essence. I mean, if you're fighting these wounds, you need to get after them. And lo and behold, I ordered the hypoallergenic one mistakenly. And it wasn't quite as effective for me, and I decided I would call there and make sure that I actually ordered the wrong one. And it was about 5:30 in the afternoon, and this gentleman came on the phone, and lo and behold, it was Dr. Dixon. And Dr. Dixon said, "Well, no, Kurt, we had that order that you ordered the hyperallergenic one, and let me send you out another tube tonight. You got it in the mail to me that night, blue label." That's a testament of who you are. And you didn't even charge me for it. And in reflection, I knew I made the mistake, but you were so concerned about me having the right product that's what you did for me. That's how we first met each other on the phone. And I've been grateful ever since. So, I could stand on this soapbox for a long time, but let's not take up too much of everybody's time. Dr. Dixon, I'd love for you to come back and chat with us again when we can come up with an excuse. Do you have any final thoughts you'd like to share with us today?
Well, thank you very much for calling me. It was a big surprise out of the blue when Enos, our customer service manager of 14 years, called and said, "Hey, Justin called. He wanted to thank you. He's doing podcasts now. Would you be interested in doing an interview?" And I was very humbled and grateful for the opportunity. And I'm humbled and grateful for the kind words you've said about how we first met. And that's the way we do things around here. It's not about money, it's about the client, it's about doing what's right for our fellow man. And I'm very grateful and appreciative for this time sharing how we came to meet and your successful story. And I will be here anytime for you. Hopefully, we can do this again. And it will be my pleasure. Thank you very much for having me.
Thank you, Dr. Dixon. Hey, everybody, hang on. After I do my closing remarks, I'm going to show a 4-minute video that he put together that'll shed some additional light on this. So, thanks for joining us. Remember, additional information and links provided in the videos. Read more. This has been Justin Case and David Dixon, getting in after solutions in wound care. Please be sure to subscribe to this channel to stay connected, and please connect with DermaWound in the links below so you can learn some healthy revelations and enhance your life. Enjoy this video.
Even if you think you do have the best wound care, hospitals, surgeons, doctors in the world, it's no guarantee that their treatments are going to be better and more effective than DermaWound. Just ask Christopher Reeve. Christopher Reeve, Superman, had all of the tools in the world available to him, yet he died of sepsis related to an infected bed sore. So just because you think you have the best doctor in the hospital in the world, they're doing the best treatments, the best modalities, all the latest stuff, that you're being treated to the best capability of anybody on the planet, it's not necessarily true. In actuality, if you're a celebrity or if you're a famous person, someone of great wealth, you have a higher chance of increased morbidity and mortality going into the hospital with a wound than you would if, let's say, you're just a normal average Joe. You're a UPS driver with a venous aces leg ulcer. You're just a soccer mom and you've got a diabetic toe. The less you do with a wound, in my opinion, the better. You don't need a fancy hyperbaric oxygen chamber. You don't need wound vacs. You don't need a product like Regranex that it's a very expensive product. It has a black box label warning to it. And I just don't think any of those are necessary. All you need is one product, one very effective, relatively inexpensive product, and that is DermaWound. Conventional wound care can be a cash cow for insurance companies, Medicare, Medicaid. There's a lot of fraud involved. With DermaWound, it's going to save your bottom line. You're not going to have to spend $150,000 to treat a stage 4 bed sore. When you use my product, it costs $750, let's say. As amazing as it sounds, I've actually been told in the past, Dr. Dixon, we love DermaWound. It's the best product we've ever tried in the world. However, let me look around. It works too good. We can't make money off of it. I've got a $700,000 hyperbaric oxygen chamber I need to use. I need to use these wound vacs. I need to get time in the OR to do surgery. I need to do muscle flaps. I need to do all of these things. And I say, well, I think you're in the wrong profession. You should really be doing something else, because I'm in the profession of helping people. Everybody else around me is in the profession of trying to truly help people. It's just the morally and spiritually correct thing to do. We're not in this just to have a new house payment or a new car payment or build a new office. We're here to help people, and that's what DermaWound does.